podcast, we have Vishakha Goyal ma'am, co-founder Clinicspots. Thank you ma'am for gracing our podcast today. Today we'll be talking on digital asset management for healthcare.
Thank you so much for the introduction. So when I talk about digital asset management in healthcare, I found a lot of challenges which business owners like hospital owners, clinic owners or doctors managing their profiles find, from clinic management software, hospital management software, lab data, pharmacy, the stock management. Everything has a username and a login ID and a password. Then comes the website, the Instagram page, the Facebook page, which actually brings the business, Google business profile. And it goes on and on. How to keep a track of everything. There comes Clinicspots. There comes the empowerment of Clinicspots. Clinicspots ensures that all the data of the doctor is managed.
Now my question to you is, how Clinicspots contributes to healthcare owners?
So what Clinicspots does is not only manages their user logins, but also ensures that we can provide them all the digital services end-to-end. Manage their lead management systems. We have our own lead management system that we provide them. Then we have the clinic management software or the hospital management software, which tracks everything from the patient entry, the patient IP, or the patient, consultation, what doctor's opinion, what was the doctor's, which doctor did she consult or he or she consulted, and what was the doctor's opinion on it, pharmacy, everything is in one place. A business owner, a healthcare business owner does not have to connect with 10 people to look into the same. And that comfort zone Clinicspots has created. Not only with that, the lead management system tracks the patient from every source. If it is coming just as a walk-in, if it is coming from an Insta page, an FB page, or incoming call, or from the website, whichever source, any ad, so whichever source, all is captured under one app. Which caller, which salesperson, I won't tell salesperson, which counselor is connecting with that patient is important. And what is the interaction that has to be recorded. So once that is done, it helps in the improvisation of the hospital. The feedback of the patients is important. Ensuring that the patient comes in once is left, then another one gives a call and takes the feedback of the patient, understanding how the journey of that patient has been in that hospital or clinic. That has helped them to improvise their services also. So all clubbed together, Clinicspots play a very important role in the healthcare system today.
Wow, that's an interesting piece of information, ma'am. I hope our viewers who are watching this will really claim the benefit of it. So, as per my interpretation, I understand Clinicspots is corely into medical tourism. Could you please shed some light on that, ma'am?
Yes. So, Clinicspots' core avenue is medical tourism, wherein we have patients from all over the globe coming on our website and leaving the query to travel to India for their treatment. And we have a team. Once we receive the query, it's an online query. So once we receive the query, then we have our team connecting with them and providing them with appropriate information on their medical treatment. We serve all countries, including US, wherein patients come for their dentistry treatment and cosmetic surgeries. We treat, our maximum patients are for cancer, and they are from Bangladesh, Africa, parts of Africa, and various other countries. We are associated with more than 300 hospitals across India. And you would have seen our database. We have a huge listing platform for doctors, clinics and hospitals. So anyone wanting to be on the prominent positions also connect with us.
That's really huge, ma'am. And I believe we are doing very well with it. That's a brilliant feature that's just come up. So this gets me to a question. Ma'am, what about the clash between an online appointment booking system and an offline appointment booking system?
Good question. So here covers the gap. Clinicspots covers this gap also. So the doctors can manage their online and offline appointments on the appointment booking software itself of Clinicspots. So Clinicspots has the scheduler. It helps the doctors to maintain and manage that also.
That's something revolutionizing. That's something really revolutionizing. While going through Clinicspots website, I again came through something new. We have a hospital management system, right? Ma'am, could you just tell us more about it so that clinics and hospitals can take advantage out of it?
So, the clinics and hospital management software helps the clinics or hospitals to manage their patient from the reception to the appointment, the pharmacy, the laboratory, and the discharge. The follow-up again of the patient with the complete history. So this helps to, helps the centers to manage the complete history and database of the patient.
That's really nice. Clinicspots has now become a one-stop destination for all of our medical queries. Thank you so much, ma'am, for giving an insightful session on Clinicspots and its works. I am genuinely pleasured to have this conversation with you. We'll next meet on something new on Clinicspots. Please stay tuned.